Ayurvedic concept, that is sutika parcharya. So this is very much important. Why? Because much of the cases we got seeking sutika parcharya. So clinically it. So, good evening all. Today's topic is we are going to deal with the topic which is unique and a unique Ayurvedic concept, that is Sutika Paricharya. So, this is very much important. Why? Because much of the cases we got seeking Sutika Paricharya. So, clinically it is important, and for exam point of view also it is very much. It has a very much significance because most of the time it is asked as a main question. So jumping into the topic, Sudhika Parjarya, I told this is a unique concept which Ayurveda has contributed to the public or society. So as per Ayurveda, a Sudhika is considered or a pregnant lady is considered as Sudhika is considered as Shunya Sharira, and a pregnant lady, she has to be taken care like a ambu patra. So when you keep a pot and you are moving, so you have to be very conscious so that the water should not be spilled out. So like that we have to care much. Sutika also, as per Ayurveda, after prasava, due to prasava klesha, she is considered as shunya sharira. There is a time for the dadus to replenish. So we have to give much emphasis on Sudhika Parjarya. So going to the theory parts, as per Nirukti, Sudhika means Sudhika Prasudastri. That is as per Shabda Kalpadruma, woman who had delivered recently. This is a explanation of the term. But as per Kashyapa Samhita, he has given a precise definition. That is, Paribhasha goes like this: Sudayaschapi tatra syat apara chena nirgada prasuda api na sridastri bhavatevam gade sadi. That means a lady can be considered Sudhiga only after the expulsion of placenta. So the term Sutika denotes after third stage of labor, we can call a lady as Sudika. Next, regarding Sudika Kala, there is different opinion regarding Sudika Kala. Up to what period she is considered as Sudika, and up to what time period we have to give much restriction on diet, as well as there should be a protocol for medicines also. So this varies, but most of the acharyas has a same opinion regarding 1.5 months as considered as Sudhika Paricharya, but there are according to some like Bhava Prakasha has considered up to 4 months and Kashyapa up to 6 months, like that. So it may be due to the regional variations, and also there will be the as per the Rudus, there will be change in Sudhika Paricharya also. So this you must study. As per Charaka, he has not specified a time period for Sudhika Paricharya. Often it is asked in the competitive exams, the Acharya who had not included Sudhika Kala. So that is Charaka. Then Sudhika Kala, the sloka goes like this: Anena vidhina adhyardam masam upasamskrita vimukta ahara achara vigada Sudhika abhidanasya punarartava darshana dityegai. This sloka is from Shushruta Sharirasthana. The sloka meaning is like this: up to 1.5 months there should be a particular ahara and ajara for a Sudhika. So Sudhika Kala is considered as 1.5 months, but you can up to next Artava Darshana, when she her menstruation resumes. Up to that period also you can follow these regimens. About the regimens we will discuss in the later slides. So this is regarding Shushruta. And Kashyapa has told like this: Shadbir Mase Prasudaya Dadavo Rudiradaya Pratyagachandi Arogaya Yadasam Paristamstiding Cha. The meaning is like this: up to 6 months, a woman should be considered as Sudhiga, because the dadus like Rudiradaya dadus, blood and etc. dadus which have there is a huge blood loss. For example, in case of a normal delivery, up to 500 ml of blood is lost as per modern. So because of this, there should be a time for replenishment of these dadus. So you can consider up to 6 months you have to take care of that lady. So after that, if it is not properly followed, there is chances for roga. So as to avoid the roga, so as to keep a aroga avastha, you have to follow these regimens. Like this, the Kashyapacharya quotes. So in nutshell, all the acharyas has been told 1.5 months for Sudhika Kala, and as per Bhava Prakasha, it takes 4 months. So as to take a normal course of diet and regimen, then Kashyapa has included 6 months as Sudhika Kala. So this is regarding Sudhika Kala. Next, Sudhika Paricharya. There is difference of opinion regarding Sudhika Paricharya. It's maybe we can, if you think, it may be due to the regional differences. When you see also the climate and the Rutu in Tamil Nadu is not same as Kerala. There is different, and the food pattern is different. So maybe because of that, this much of differences may be there, and there is a similar. Actually, there is similarities and there is difference of opinion. So you have to study each in detail. For a PG student, you have to study all these things. But for a UG, you can study only one opinion. Other opinion you have to you have to understand. Next, Sutika Paricharya, I'm going the opinion of Charaka. All the Acharyas' opinion are discussing, but sloka wise, we are first dealing with Charaka Sharira Sthana. It has been told like this. Sudikam tu ghalu bubukshidam viditva sneham payayeda paramaya shaktya sarpis tailam vasa bajjanam va सात्मी भावम अभिसमीक्ष्य पिप्पली पिप्पली मूल चव्य चित्रग शृंगवेर चूर्ण सहितम स्नेहम पीतवत्याश्च सर्पिस्तैल अभ्यज्य वेष्टयेत् उदरम महदा अच्छेन वाससा तदा तस्य न वायुरुदरे विकृतिम उत्पादयति अनवकाशत्वात् जीर्णे तु स्नेहः पिप्पल्यादिभिरिव सिद्धां यवागुं सुस्निग्धं द्रवां मात्रशः पायेत् उभयतः कालं च उष्ण उदकेन च परिषेचयेत् प्राक् स्नेहयवागुं पानाभ्याम् एवं पञ्चरात्रं सप्तरात्रं वा अनुपाल्य क्रमेण आप्यायेत स्वस्थवृत्तम् एतावान् Sudhikayah. When you hear this sloka, you may not get anything. I will go in detail regarding each of line. So it goes like this. After Sudhika. So here you have to assume that this is after the third stage. In though it has been written in BCs, I usually say all the references are written on in those periods. You have to adopt the principles. Nowadays we are having active management of labor and etc. So in this context we have to we will not get a Sutika soon after this delivery. So within 24 hours, we will not get patients. So we have to analyze the things, and based on the situation, we have to apply this into our clinical practice. The Sutika soon after this expulsion of placenta, where if she feels hunger, one should administer sneha pana in mahadi matra. Mahadi matra means sneha which digests for 4 yama. Nowadays it's practically it is not possible, and sarpi either with sarpi, taila or vasamaja. These are the chadu snehas, either in a single or you can use combination, that is yamaga or trivat sneha. Like that you can take, and you have to administer sneha. Then along with that you have to add pippali moola chavya chitraya, that is panchagola churna. You have to add in that sneha, then you have to give. This is the commentary goes like this, that snehapana, actually snehapana here is giving in a Jangala Desha Pradesha Stri. In Jangala Desha there is Rukshada is there. So in that context you have to give snehapana soon after sudika avastha. But normally you can it is not in a anubadesha stri, it is you should not do like this. So when you consider Kerala as an anuba pradesha, so we know, we for us it we know we need not to take this principle. Then after giving snehapana you have to bind the abdomen mahada achena vasasa with a large cotton cloth. You have to band you have to make a band around the abdomen, and also you should massage the abdomen with this snehas. Because why this is doing means after sudika avastha there is immense vadak pragoba due to anavakashatvat. Because when this fetus and after birth expels out, there will be the abdominal girth will be reduced, and in that there will be accumulation of vayu. So to prevent that you need to give an abdominal bandage. Then because of this na vayu udare vigridi utpadedi, there will not be any complication because of the vada dosha. And after this jirna of this sneha, you are administering sneha in a mahadi matra. After this digestion you can give vipalyadi siddha yavagu susnigdam. You can give yavagu, that is ganji, which is prepared of pipalyadi churna and grida. That we are nowadays we in our clinical practice we adopt this principle. Usually after normal delivery you can start sutika paricharya after 4 or 5 days, or depends how when the patient comes like this. So yeah, this is given. Why panchagola is administering means panchagola is a good garbhashya shodhana dravya. So patient will be so as to eliminate the uterine afterbirth and contents. We are giving this. In our practice also, when the patient comes and she is telling that lochia rubra, that is reddish discharge is coming per vaginum, we will administer panchagola yavagu. If it is not there, no need to start also. But if the patient says that she is having a less agni is not proper, if you are feeling so, if you are finding such an presentation, you can administer pipalyadi yavagu. Next, this regimen should be followed pancharatram saptaratram up to 5 to 7 days, depends upon the agni. You can adopt this principle. And also sudika should be given parishejana with ushna udagena both times, morning and evening. Hot water parishejana should be done. Like this Charaga's opinion goes. And kramena sastavritam anupale. Gradually you have to adopt normal regimen. This is a common regimen which has been told in Charaka Samhita. I had made a table, number of days up to 5 to 7 days based on Agni, Snehapana with Yavagupana, Pipalyadi Dravyas should be administered, and Abhyanga can be given. In Charaka Samhita, there is no specific mentioning about Taila. It only told that Abhyanga can be given, should be done. Then Parishejana with Ubhayagala. Ubhayagala means twice daily. You have to give Ushnodaga Parishejana. And the main thing which has been told is Udaraveshana after Sneha Yavagupana. Then Kramavat Apyayana. Gradually you have to make the normal regimen. And Sustavrta Paripalana. Whatever regimens which has been told in the context of Sustavrta, that should be followed. Next, according to Shushruta having some difference of opinion, has told that Balataila Abhyakta. For Abhyanga, Balataila has to be done. Or also, Vadahara Aushada Nishkwada Upachari. You can adopt for after Abhyanga, you can give a Vadahara Aushada Kwada Parishejana. Like for example, like Eranda Patra, etc., can be given for Parishejana after Abhyanga. Then Sashesha Dosham tu Tadaha Pippali Mula Chavya Chitrakera Shungavera Churnam Gudodakena Ushnena Paye Evam Dviratram Triratram Va. So in Charaka Samhita we have seen that the same medicine Pippali Mula was given as a Yavagu, or it is given as a Snehapana, that is Parameya Shaktya. But here Acharya has told that you can give it in with Guda, Ushna Udaka and Guda, you can add Pippali Mula Churna. This is commonly we are practicing. we will give with hot water. We'll tell the patient to add some jaggery and panchagola churna is giving. So this is a good garbhashaya shodhana dravya, and this can be given up to 2 or 3 days, 3 ratram, up to 3 nights you can give. Then adushta shonida, that is very important beauty of our science. He told that adushta shonida, that means this is a very good uterine that it normalizes the uterine endometrium. That's what we can say as per modern. When in endometriosis like that, in any kind condition where there is no proper uterine muscular contraction is not there, and there is no proper shedding of endometrium, this principle is we are taking. We are administering Panchagola Churna. So in Sutika, as you know, there will be remnant of blood vessels or bits of afterbirths will be there. So as to eliminate that, you have to give the Panchagola Churna with Gudodaga. Then Vishuddhe Tado Vidari Gandhadi Siddha Sneha Yavagum Va Paye Tirat. When the discharge, vaginal discharge become like that sarosa, when it becomes normal, discharge is coming per vaginum, you can give Vidari Gandhadi Siddha Sneha Yavagu. Vidari Gandhadi is somewhat Brahmana. It is a little bit difficult to digest. So when you administer Panchagola Javana before, it means the Agni will be corrected, and then you are giving a Vidari Gandhadi Siddha Sneha Yavagu. So that reduces Vada also, and Vidari Gandhadi is a best Stanya Janaga drug. So you may be knowing after 4 days the colostrum secretion decreases and normal breast milk secretion starts. So this procedure accelerates that normal breast milk secretion. Then tado yavakola kulatha siddhena jangala rasena shalyodhanam bojayed balam agni balam chavekshya. The main thing is that after Vidari Gandha, the Siddha Sneha Yavagu Pana, there will be slight variation in the Agni. So you have to assess the Agni. Then you have to give Yavakola Kulatha Siddha Jangala Rasa. Jangala Rasa is Brahmana, or it is Guru in nature. And along with that, he is adding Deepaniya drug. And Kulatha is like, it is Garbhashaya Shodhana, and it has a specific action or Garbhashaya. We are giving Kulathadi Kashaya in case of PCOS, etc. So this from this references, we are adopting that principle there. So coming on to this topic, so in case of Sudiga, as per Shushruta, you have to give an Abhyanga with Balatailam, and you have to give Parishejana with Vadahara Uchada. Like for example, in Kerala, we use this jackfruit plant's leaf for this. It is the best Vadahara Dravya. And after Sashesha Dosham to Tadaha Pippali. Sorry, 1 minute. Sorry, 1 minute. And Agni Deepana with okay, okay, thank you. So first you have to give Balataila Abhyanga, then give a Vadahara Aushada Nishkwada. You have with Vadahara Aushada, you have to give Ushnajala Parishega. Then you so as to make Garbhashaya Shodhana with Pippali Muladi Churna along with Guda. That is very important. In my sloka, it is Gudodaga. Sorry, it is Gudodaga. Gudodaga, sorry, I have written as Gudodaga. It is Gudodaga. In Ushnajala, you have to take for 2 or 3 nights, so as to make the uterus vaginal secretion normal. Then after you give Vidari Gandhadi Siddha Sneha Yavagu for 3 days. Then Yavakola Siddha Jangala Rasa has been told. So this Yavakola, when you assess the time, it will be up to 7 after 7 or 8 days we can start with Jangala Rasa. This is regarding Shusha Samhita. And also you have to avoid Krodha, Ayama and Maiduna, etc. as Vara. I have been made this a table. You can see this up to 3 days. As we told, Vadahara Ushna Nishkwada and Ushna Gudodaga. Then up to 7 days, Nehayavagu or Kshirayavagu with Vidari Gandhadi Devyas. And 8th day, you can start Jangala Mamsarasa. This thing you have to keep in mind. 8th day, they are starting Jangala Mamsarasa as per Shushruta. In exams, particularly in competitive exams, it is so usually asked because there is a difference of opinion. In you will see in next in Vagbada. Vagbada has told in Ashtanga Hridaya, he has told Pishida has that Mamsarasa has been started from 12th day onwards. So that is usually asked in exams. Only for exam point of view, usually after 1 or 2 weeks, based on Agni, she can start Mamsarasa if she is used to it. Then, as per Ashtanga Hridaya, the sloka is like this: Mukta aparam yonim tailena angam chamardaye. So this is very much important. The sloka has covered almost all the things. So better to study an Ashtanga Hridaya sloka. So the sloka from anyone, either Charaka, Sushruta or Ashtanga Hridaya, one you have to by heart. Then Sudigam Shuddhadim Tailat Kridat Mahadim Pipe. In Ashtanga Hridaya also it has told that you have to give Snehapana in Mahadi Matra after Apara expulsion. After the expulsion of afterbirths, you have to give an Abhyanga over Yoni as well as whole body. Then you give Snehapana in Mahadi Matra, and then Panchakolagini Matram Anuchoshnam Gudodagam. You have to administer as like told in Shushruta. With here also I have written Gudodagam. It is Gudodagam. Gudodagam. Sorry for that. Gudodagam. That is with Ushna Jala, Guda is added, and along with that Panchakola Chuna is adding. Then Vadagna Aushada Toyamba with Vadahara Aushada Toya has also administered so as to avoid the Vada Pragopa. In most of the Sutika yogas, Vada Visheshan is the main causative factor. So here Acharya has given prime importance for the Vada dosha. Then by this there will be Vishodhana of Dushtasram Dvitriratra Mayam Kramaha. Up to 2 or 3 days you can follow this regimen. Then Sneha Yogyatu. In Charaga and Sushruta there is no mentioning about the Sneha Yogya persons. So here Ashtanga Hridaya says that Nisneham Amumeva Vidim Bhajet. You know, need not to add Sneha. You can give a Panchakola Churna with Gudodagam. Pidavatya Jadaram Yamakaktam Visheshe. After this Pana of Panchakola, you have to bind the abdomen with cloth which is smeared with Yamaga. Yamaga means combination of two, either Grida or Vasa or Grida or Taila, like that. You have to bind. In general practice, we use Dhanvandaram Kuramba. In Malayalam, the term is like that. Dhanandaram Kuramba is nothing. It is a Yamagam. It is a combination of Taila and Vasa. So Dhanandaram Tailam is told specially for Sutika. It is told that Dhanandara Tailam, it is Marma Sutika Marmasti Kshadak Shineshu Pujidam. It is said like this. Sutika for Sutika and Marma in labor there is severe Marma Kshada is there. So for supporting that you can use Dhanandaram Tailam in practice. Then Jime Snada, after the Sneha becomes digested, you can give a Peya with the Purva Aushadis, that is with Panchakola. Then after Trahya Turgam, after 3 days, you can start Vidari Gandhadi Yavagu. In practice also, we are using Vidari Gandhadi Yavagu. In case of breast milk production is reduced, in that condition, this Vidari Gandha is a very tremendous drug. Then after Hidaya Vagu Snehadiya Satmedaha Payasadava. You can give Sneha or you can administer with Kshira also, based on the Satmya of that patient. If she is Satmya for Kshirapana, you can add Vidari Gandhadi Churna, can give processed as a Kshira Yavagu. Saptaratrat Param Cha Asya Kramasho Brahmanam Hidam. Before 7 days, you should not administer any Brahmana Dravya. Say after 7 days only you can administer Brahmana, that too Kramashaha Brahmanam. Gradually you have to give a Brahmana Dravya. Dwadashahena Adikrande Pishidam no Payoche. In Ashtanga, strictly say that before 12 days you should not give Pishida, that is meat should not be given for a Sutika. Like this, Ashtangas, they are reference codes, but in Shushuda it is told that after 7 days, that is from 8th day onwards, you can use Pishida. This is often asked in the exam, so you must keep those things clearly in your mind. As per Shushuda, this Mamsa Dasa can be given from 8th day onwards, that is after 7 days. Then as per Ashtanga Hridaya, after 12 days, Pishida has been told. So this is as per Ashtanga Sangraha, that is similar with Shushuda only. So I am not going into that. Same as Shushuda, and one thing is different is yes, up to 8 days it is similar with Shushuda, and after 7-12 days it is as per Ashtanga Hridaya. Need not to study this because main three you have to study. Then, as per Kashyapa, the Kashyapa sloka is very big. Need not to study that. You have to keep the main points in your mind. Up to 3 to 5 days, the Acharya has told Mandapana. Manda is the supernant portion of the Ganji. We will tell no that Manda portion, that clear portion, that you have to administer for Sudiga. When in practice also, we are telling the patients to take a ganji or light food you have to take, and hida bhojana also. Then snehapana with snehayukta same, that pippali nagara lavana rahida yavagu. The main thing is that you should not administer lavana in yavagu. Then from 7 to 12 days, then you can add lavana also. Then from 12 days, kulatayusha jangala mamsarasa grida varjita shaga is vegetables which is fried with grida, that you can give. Then from after 1 month, snehana swedana ushna jala, that also you can you have to do up to 1 month, not from after 1 month. Up to 1 month you have to give snehana swedana and also ushna jala sevana. Then vihara rakshogna devya ashwasana kukshi prishta pashwa abhyanga samvahana in nyubjasana. Samvahana means you have to sit in a nyubja position, and you have to give an abhyanga over kukshi prishta pashwa pradesha. Then udara pidana, it's so because it may be like a very much sagging of abdomen, it will be there, and with the visheshana of vayu. So as to prevent that, this procedures has been told. Then udara vaishna, which has been told here, baladaila purida charma. So the lady should be sit over a cushion or a bag which is filled with baladaila. That is specifically mentioned by Kashyapa. It might be helpful so as to make the Kati Pradesha to most, it may be enhancing that strengthening of that part. Then Yoni Svedana with Priyangu, etc. So this will prevent any kind of infection. In those days, we are not giving an antibiotics, or we are not giving even a proper suturing also not there. So as to prevent that infectious causes, they are advising that Yoni Svedana, then Ushnodaka Snana, then Dubana, Kushta, Gulu, etc. These are Krinigna Dravyas and Akshogna Dravyas. So for Navajada Shishu Parijaya also, that Kushta, Gugulu, etc. are told for Dubana. Then, so when you are explaining diet to a patient, you can adopt the principles of Kashyapa. Next, Kashyapa has specifically told Sutika Parya as per the Desha in Anupa Desha. For example, Kerala like country, you can start with Manda Prayoga with Agnivardhaka Dravya and Ushna Jala Sevana in Jangala Pradesha. For example, like Rajasthan, like the countries, you can add Sneha because that much of Rukshatva will be there in that place. And the Rudu also, they are having a prolonged they will get a short monsoon period. So in that cases, you can add with Sneha Upachara. Then in Sadharana Desha, neither to Sneha nor to Ruksha Dravyas has to be followed. Then in it is Videshastri. Videshastri, he might maybe at that time he may be aware of that Western countries. I don't know. He has specifically told Videsha. In neither of our Samhidas, we will get a reference like this. They are in sloga it tells like that. That is, they are more used to with rekta, mamsa, niryuha, etc. So in those patients, they can, so in those ladies, they can start this kanda, mamsa, etc. After, just soon after Sutika period also. And Viharas, Svedana, then Nivada Shaina, Snehopachara has been told. Then according to sex of the child, this is also Kashyapa says that in case of a male fetal delivery, you can give tailapana with deepani aushadhi. In case of, if it's a female fetus, you can start with gritapana with deepaniya samskridayavagu, and later both can continue mandadi prayoga. So, in exams, it is asked which Acharya has explained Sutikaya Parjarya according to the Desha and as well as with the sex of the child. It is asked like that. This point you have to keep in mind. Next, Sudhika Pariyacharya according to Harida. That is why I am telling each and every Acharya's opinion means, for a UG students, just you keep in mind that Harita has also an opinion regarding Sudhika Pariyacharya. There is a reference. But for PGs, you must study all those things. That after Prasava, you can start Lodra, Arjunadi, Dravya, Kwadabana. These are Hridya Dravyas. So that there might be an action. And for first day you have to follow an Ubbavasa, and second day Guda Nagara Haridaki Sevana. Guda Nagara, I told that it is Garbhashay Shodhana, and Haridaki it is Anulomana. That might be an induce a contracted action over the uterus, and also Ushna Kulatta Yusha Sevana. This thing you have to keep in mind. Kulakta is Patya for particularly for Sutika, that you have to, because all the acharyas has been told, and in clinical practice also we are advising the patients. Then third day onwards, Panchagola Yavagubana. All the acharyas has told that Panchagola should be started since from Aparapadana. Here in Harida there is a difference of opinion. It is started since from the third day, and fourth day Chadurjada Vimmishrida Yavagu can be started. 5 or 10 up to 15 days Shali Shashti Godana. Shashtika Shali should be administered. Shashtika Shali it is a Shali Shrestha as per Ayurveda, and it is very rich in vitamins B12 and other etc. So that is very much good for the Sudhika, and it will enhance the digestion, and also replenishment of dhadus will be proper. Then Vihara, Yoni Apurana, Abhyanga, Ushnajara Swedana, Mangalavacharana, Yoshata Pradarshana. It has to like that. That is, whatever that lady seeks, that should be fulfilled. Like that, the reference goes. Next. So, this is, I had explained all the textual references regarding Sutika Paricharya. Next, in practical, what we are adopting, you have to adopt these principles. Whatever medicines that you are giving, it should be of Vada Shamaga property, and at the same time it should enhance the Agni also, and it should be Pajana in nature, and always all the drugs should have a property like Rakta Vardhana. For example, we are giving Draksha Arishtam. Draksha is nothing but it is acting on Rasadadu, and in that result what we get as it increases the HB, and it should be Stanya Vardhaga and Garbhashya Shodhaga, Yoni Samrakshaka, Koshta Shodhaga, and it should increase the Dhatu Pushti, and it should be Balya. So whatever medicines you are taking, you are adopting based on the condition, and also based in Sutika Paricharya, you have to keep the thing that you have to consider Rutu also. So during monsoon season, we are not giving a Yavagu Pana. So in Kerala, in summer season, it's so hot. In that time, we are administering starting from Yavagu Pana. So like that, there is seasonal variations in Sutika Paricharya also. So this is in clinical. So when in clinical practice, we get patients for postnatal care. So it will be like after normal delivery, or after some complications like abnormal delivery like CS or forceps delivery. So in these conditions, there will be variation in Sutika Paricharya. We are adopting this principle, but the Sutika Paricharya is not unique for everyone. It is a individualistic medicine or concept that we are adopting. Then prolonged labor, and in if a lady is having a gestational diabetes mellitus, we are not giving arishta for them. We are giving churna in that. For example, Pipalyasamam we are giving instead of Panchagola churna for a Vada Kafaja Prakriti person. In Pitta Prakriti, we will not start with Arishtam. Arishtam is best Garbhashe Shodhaga. So Panchagolasam we will give for a Vada Kavaja Prakriti person. For Pitta Prakriti, we will start with Panchagola Churna. The same when in monsoon season it is different, and the same is different in summer also. So we need to design this protocol considering all the factors that which I told. Next, there will we have to give a separate care after abortion. Also, there is we are giving care, but not up like this yoni abhyanga, that are not much done, because in that case there is a slight vitiation of vada, vada vitiation. In that case we have to give garbhashe shodhaga, and at the same time we are giving rakta vardhaga. Not much vada vardhaga divyas are needed, and so much of brahmana divyas also not administering in normal labor. Starting from this yavagupana, we will go, I will next, then I will go like this. Up to 1.5 months, you have to give an intense care. Up to 1 to 4 months, you have to give minimal care and efforts. And up to 4 to 6 months, just patyachara is necessary. So I will tell, see, in Sudika, there will be, this is regarding normal delivery, there will be prasava klesham will be there, and excessive kleda vriddhi will be there. When you notice a patient, you can clearly grasp these things. There will be edema over the legs and independent parts, and the cheeks will be somewhat bulged. So like that, there is signs of Kledavardhi, and there will be Raktakshayam as well as Dhatukshayam. Agnibandhyam will be there, and emotional trauma will be there in that patient. That will be leading to excessive Vada Prakopa. Then free space in the Udaram will be there. Sudden the abdominal uterine girth is reducing. So the Vada will occupy that free space. That's why the Acharya might have told that Shunya Sharira, and there will be bleeding. That is different from each person to person. So nutshell, there is Vada Prakopa, and also there will be perineal injury, remanence in the uterus will be there, and we have to assess the lactation also, and there will be pain, vrana, dushta shonida, kledam, sanyasodam, all these things will be there if a patient comes to you within 7 days of within 7 days of puerperal period. So in that patients, first you can start with, like as I told, with Panchagola. Based on the condition, you can start with Panchagola. If she gets an Agni Dipti and the Lokya rubra has stopped, Lokya rubra is the reddish discolored secretion from the vagina. If it is stopped, you can start with Vidari Gandhadi. In case of a patient when they are telling that I am not having that much of breast milk production, if it is adequate, you can start with this Dhanvantaram Kashayam, like that, or Nadi Kashayam you can start. That's all we are using in general practice. It can be continued up to 7 or 14 days. If within 7 days the patient says that her Agni is reducing, you can again give an Arishta, like the Shamula Jiraga Arishtam. The Shamula is Shodhara and Jiraka is Dibana or Clay the Shamaka in action, and also in the Falashruti, Jiraga Arishtam is specifically told for Sudika. So you can start with that. Then if the patient stays somewhat when Agni gets okay, you can again give an Mustadi Marma Kashaya, like that Kashaya you can give, or otherwise you can directly go for a Brahmana like therapy. You can administer, if a patient is a non-vegetarian, you can adopt Brahma Rasayanam or any other kind of Rasayanam, like that you can adopt. If the patient is not that much of shifts of mixed or non-vegetarian diet, you can give ajamamsa, ajashwagandhadi lehyam, or ajamamsa preparations. Ajamamsa is very good, said to be good for Sudiga. So that you can adopt. And since 4 to 6 months, you can advise Pathya. Pathya, that is soon after delivery, Manda or Yavagu is best. After 7 days, you can start normal food where it is processed with ghee and this lashuna or the small onion, sataivam. So with that process you can give. And also this dhanyaka and methika is said to be best for sudhika. And after 4 to 6 months there is you have to supplement calcium, because the baby is feeding breastfeeding, so there will be depletion of calcium. So in that case you can adopt this ragi, rice soaps, and dhanyaka, methika. These are all good for sutika, so as to replenish the dhatu, and as well as it enhances the breast milk production. And also mamsarasa can be given, as I told, mamsarasa processed with dibaniya dravyas, for example panchakola also you can give, and shatapushpa churna. That all are very good, and that we are adopting in our clinical practice. So this slide I told in the earlier. So to sum up, when a patient, this is regarding a clinical point of view, I am telling, up to 3 to 5 days you can give Kledahara and Deepana medicine. And for example, this Dashamula Jalapanam, Jeeraga Toyam, or Shringaveram, that Pipali Muladi Toyam, Gudodagam, that you can give. And also there is some preparations that is mostly a Kerala tradition preparation, that is Pulingurambatal. It is a granular somewhat layher form. This is main components are Pipali Muladi only, and then there is a Kurinji Koramba like preparations there, that also are Garbhashya Shodhana. Its main drugs are Deepaniya drugs only. Next, up to till the 12th day, you have to adopt this Deepaniya protocol, and diet should be strictly vegetarian. In any patients that diet, preferably it's better to go for a vegetarian diet, because in there will be perineal injury, and anal sphincters also somewhat injured. In that case, if you are administering a non-veg diet, the fibers, there is chance for constipation, leading to discomfort and also somewhat problems in the sudhika. So better not better, always you prefer or suggest vegetarian diet like Yusham, then Vidari Gandhar Siddha, Yusham, Evago, etc. can be given. Then till 28 days, Vadashamaka has to be, Kashaya can be followed, like the Nandran Kashayam I told, and the, like Nadi Kashayam, or you can adopt Mustadi Manma Kashayam, like that you can give. And also diet you can add after till 28 day, Mamsrasa can be added. Then up to 6 weeks, Brahmana has to be followed. Then normal diet can be resumed. But keep in the mind that avoid katu, rasa, and tikta mostly, because these are stanya shoshaka in nature. So better you go for a madhura rasatmaka dravya. Then up to 6 months, rasayana has to be followed. Then you can start a normal diet as in pre-pregnant state. This is regarding the Sudhika Paricharya. Next point, that is next our syllabus point is Sudhika Roga Samanyandindana. When the above said regimens are not properly followed, there are chances for Sudhika Roga. The sloka goes like this. This is from Kashyapa Samhita. No need to study the sloka for UG students. Ratro nirgamanaat trasat sahaso utpadanadabi irshya shoga bhaya krodha anna vega vidaranat edanyischa narinam vyadayah sambhavanti sudhikanam divasopnat ajirnat adyashanadabi. The sloga is like this. Going out during night hours, experiencing terror. So these are all the psychological factors which has been explained. In Sudhika, there are chances for like we tell us postpartum blues. So there are chances for such kind of conditions. So better you have to psychologically keep the patient in a comfortable level. Then falling from height, that is regarding the physical trauma. Then feeling of jealousy, grief, fear. These are all psychological factors. That and the main cause is psychological factors in Sudhika that will lead to Sanyakshaya, then a suppression of natural urges, and also day sleep, intake of food before proper digestion. Agni should be kept in a proper manner in case of a Sudhika. Whether if Agni Dushti is there leading to Rasadadu Dushti, Stanya is Ubadadu of Rasadadu, again Stanya Dushti will be there, that there will be not proper Stanya, Dushta Sanya will be there, and the fetal neonate will have such kind of presentations. Most of times we get like that, the baby is crying throughout night, not properly taking sucking the milk, and when they are not properly sucking, milk ejection will not be there properly. When the sucking reflex causes oxytocin to release from the pituitary gland, then only there will be secretion of milk. So all together will be a problem. So these things you have to avoid. These are the samanya nidanas of a Sudhiga Roga. Next, Sudhiga Roga Sankhya. Regarding Sudhiga Roga, we will get reference from Kashyapa Samhita only. In Sudhiga Upakramani Adhyaya, there is a separate chapter for Sudhiga in Kashyapa Samhita. He has enumerated 64 rogas, and in Dushprajada Chikitsa Adhyaya, he has told 35 rogas. But in between this Sudhiga Upakramani Adhyaya and Dushprajada Adhyaya, 25 diseases are common. Just to study the number only, no need to go in detail. In Samhita also, detailing of all this rogas has not told, he has just enumerated. Next, Sudhika Roga Samanya Chikitsa Sutra. How you should treat a patient with Sudhika Roga. Sudhika Roga Shantitam Kuryad Vadaharin Kriya. Vadahara management is the principal line of treatment in case of a Sudhika. Tasmat tam yedoktena vidina upacharet Baudiga Jivaniya Brahmaniya Madhura Vadahara Siddha Abhyanga Utsadana Parishega Avahagaha Annapana Vidibir Visheshad Upacharescha Upachare. In Charaka Samhita, that's whatever we have told in the Sudhika Paricharya, that is Abhyanga, Avagaha, Parishega, that all to be followed. Along with that, you should administer Baudiga Jivaniya, Madhura Brahmaniya. That I told for Vadahara, Rasayana is the main line of treatment. That should be followed. Then in Kashyapa, the reference is like this: Yaha Krishrena Prajayande Prasudayash Chamayandiyaha Snehas Swedehi Tasmat Tasam Kshipram Vayum Prashamadi Yavagum Te Deepaniyam tu Smridiman Dadumarhati Yada Sugam Nari Niruja Shayane Sugi. So in case of a Sudhiga Roga, better you go for a Yavagupana with Deepaniya Aushadha, and the diseases, the Chikitsa has been told in Kashyapa Samhita. Jwara Chikitsa and Makkala Chikitsa has been elaborately told, and this is we are adopting for almost all kind of Sudhika Chikitsa. Next, Sudhika Roga Pathya. What all things we can tell the patient in Sudhika Roga. Sudhika Rogeshu Vada Shleshmodbhaveshu cha. The dosha which main vitiated are Vada and Shleshma. Tatra Roga Anuku Kalpena Patya Patyan Vinided. Based on disease, you have to consider the Patya Patya. Deepanam, Pajanam, Madhyam, Purana, Madhyam Puda Niranaha, Shali Shashtika. Because in practice, you might see that we are abundantly using Arishtas for Sudhiga, but as per the classical references, Arishta is not told in the Samanya Sudhiga Roga. Arishta has been told in one context, is that Aprajada Chikitsa, in case of abortion or such cases, you have to give Arishta. And in Sudhiga Roga also, Arishta has been told. And I told in Jiraga Arishta, in context, in the sloka, it has been told it is Patya for Sudhika Amaya. So, and then also Shali Shashtika. Shashtika Shali is best. And Kulatha, Lashuna, Shigru. Shigru is very galactogogue. When you can just tell the patient to steam that Shigru leaves, then you fry it in a grida, and when you administer, there will be it will enhance the breast milk production. In practice, I'm very much using this principle. And Vartaku, Balamulaga, that all are Patya for Sudhiga. So when you give a Sudhiga Paricharya, you tell the patient to take all these things. Then Padola, Madulunga, Tambula, Dadima. Dadima is hematinic. So these all best for Sudhiga, for Patya. Then Saptahat Brahmanam. After 7 days, you can start Brahmana. Then Dwadashahat Amisham. That Brahmana can be started from 7 days, and this Amisha meat can be given from 12th day onwards. Sadhe Mase Vedikande Tyaja Aharadi, and up to 1.5 months, strict Patya should be followed for a Sudika. Then common medications that we use that has been told. This is classical reference, that is Triveda Yoga has been told. No need to study the sloka and all. You just keep this mind that this has been told in the context of Sudika Paricharya. Then Devadarvyadi Kwada, Pippalyadi Kwada Grida, Panjajiraga Paga, Nagaraganda. Nagaraganda Saubhagishundi are available in the market. This we will give for breast when a patient comes with less breast milk secretion. Then Pradapalangeshwara Rasa. These are the last three are 4 are not 4, 5 are available in the market. That is from the Pipalyadi Kwada to Pradapalangeshwara Rasa are available in the market. Then next, regarding a condition of Makkala, which has been told in our classics. So Makkala is, the sloka reference goes like this: Vayuhu prakupitaha kuryat samruddhya rudiram sudam sudaya hrit shiro vastishulam Makkala samnidam. This is very much important for, it is usually asked in exams, what is Makkala and where the pain is occurring, like that. So it is, Makkala is a condition where proper Rudra is not expelled from the Garbhashya, and it gets Sanchita over Garbhashya when the accumulated blood causes pain over Hrit, Shiras, Vasti, not Shiras, Hrit, Vasti, Shiras, and it is called Makkala as per Madhavendana. Then Shushruta explained like this: Prajadeshcha Narya Ruksha Shariraya. After this delivery, there will be Ruksha Sharirada. You have to give Tikshna Ushna Avishoshidam Rektam Vayuna. When the Rekta get not properly Vishodida due to Vayu, it will get Samruddha. It will obstructed in that region and around the region of Nabhi. And there will be pain and then Parsha Vasti, Vasti Shiras, and along with pain there will be Grandhi formation. This you can see if it is an infection is there, and endometritis, or if some kind of infection along with improper elimination of afterbirth, you can consider correlate with this condition Makkala, and there will be Nabi Basti Udara Shula Sujibiriva Nistyudyade Vidyade Biryade Iva Patwashas. Intense pain will be there, because whenever there is a remnant product of conceptus in the uterus, there will be intense and incoordinated uterine contraction will be there, and prostaglandin secretion will be abundant. When this prostaglandin secretion is abundant and incoordinated, there will be severe pain. So this is seen in case of primary dysmenorrhea patients. They will tell that there is severe pain during menstruation. It is because of the incoordinated prostaglandin secretion. Just told in this context. We can come into our context, to this context. Then Samandat Admana Mudari. There will be Udara Admana. There will be distension of abdomen, and also Mutra Sangha will be there. This is this Makkala is told as a end stage Vyadi. When a lady is presenting Makkala, it is Dharuna Vyadi, like that Sushruta says. So this can be considered as when improper afterbirth production, and will be leading to PPH or any kind of distressing condition, which is very fatal. Oh, so that is about Makkala. After delivery, due to Rukshada, Avishoshida Rekta get accumulated in Garbhashya, around Navi Pradesha, Vasti Pasha, Vasti Shiras. So in exams, there were the Shula, in which all regions Shula is seen in case of Makkala, like that. It is asked in exams, leading to formation of Grandhi. Then this is regarding Makkala. In Sharangadhara, there is Makkala has been given 2 types. First one is Makkalu. It is a Rektamarudha Shula Vishesha. It is a condition presenting with pain due to Rekta and Vada Visheshan. Sadivido Bhavandi. It is of 2 types. Ego Garbhavastha. One is during antenatal period, and Aparaha Sutika Avasthaya. We can consume that if abruptio placenta, separation of normally situated placenta is there, there will be bleeding from the separated placenta sites. It may be concealed or revealed. Sometimes the blood will comes out through vaginally. That is called revealed type of abruptio placenta. That blood is collected within the uterine and it is not coming out. That is a serious type. That is called. So we can correlate this kind with abruptio that is concealed type of abruptio placenta with garbha avastha makkalla. Then next is puberal period, that which we have explained in detail. Then I told Makalla, when a Sudhiga is presenting with Makalla, it is not a curable disease. The reference goes like this: Garbha Kosha, Aparasanga, Makkallo, Yoni Samriddhi, Hanyat, Striyam, Muda Garbham, Yedoktascha Anubhadrava. When a stree is presenting with either of any these complaints, it is fatal. That is Garbha Kosha, Aparasanga. Garbhasanga or Abrasanga, or Mudha Garbha we have dealt in the last class when placental expression is not proper, or after births are not properly eliminating, and there is a Yoni Samriddhi, that is cervical dystocia is there, and it will do the Hanana of Stree. That lady will, it is fatal to both Garbha and mother. Next treatment regarding Makkala. This is in practice we are not nowadays we will not get such kind of patients, but in case of Makkala I told there is a condition where proper shodhana of rakta is not there. In what all condition you see improper elimination of endometrium, you can adopt this principle. For example, in case of a PCOS patients, if endometrium is built up and she is having amenorrhea, blood is not expelled out from the uterine cavity, we are taking principle of Makkala. So in clinical practice we are getting we are using this principle. In as far as an exam point of view, Makkala is asked and you should write sloka also you have to by heart, and the treatment also. In Ashtanga Hridaya they like this: Makkalake Shirovasti Koshta Shuletu Paye Sachunidam Yavaksharam Gridoshnam Jalena va Dhanyambu va Gudavyosha Trijadaka Rajonyidam. That you can give Yavakshara Churna with Guda, Vyosha, Trijalaga. These are Garbhashaya Shodhaga. Vyosha is Pippali Moola, and Chavya, Strigadu is Vyosha. So this you can give, and also there is an explanation of Veeradaradi Siddham Ushagadi Pradivadimidam. It is from Shusha Samhita. You can give Veeradaradi Siddha Ushagadi Kwada. I will tell a yoga, that is Ayaskriti is having both these two gana. We are giving Ayaskri in a amenorrhea patient, considering this fact. Then Yavakshara with Palyadi gana can be given, or Varunadi Kwadam with Panchagola Pradivada, these can be given in Makkala. These all we are using clinically. And Prudak Parnyadi Kwadam with Badradaru and Marija, that all can be used in case of a Makkala condition. Next condition is Sudhiga Jwara, that is puberal pyrexia, we will say. As the sloka goes like this: Sarveshameva it is Sarveshameva Roganam, not Jaranam. Sarveshameva Roganam Jaraha Kashtatamo Mataha Tasya Adau Vidim Vakshare Nidana Akriti Beshajehi. In all kind of Sudhika Roga, Jara is most having poor prognosis. Then Jarasya Beda, the Sudhika Jara is classified into 6 types. That is mainly 2 types: Nija Agandu. In Nija it is Doshaja, Vada, Pitta, Kabha, Sannipadaja. Then Aganduja, it is of again 2 types, that is Tanyaja and Grahotaja. So these are the classification there in the notes. So as far as you are concerned, Sudhiga Jara is of mainly 2 types, that is Nija and Aganduja. Nija is Doshaja, that is Vada, Pitta, Kabha and Sannipadaja, 4 types. And Aganduja is of 2 types, Tanyotaja and Grahotaja. When we will say this lactational fever like that, no, when this proper after colostrum, the proper breast milk is there, there will be slight increase in the temperature. Then if any kind of abscess in the breast, it also causes puerperal fever. So puerperal fever is in nowadays also it is difficult to cure. Then samani nidana steenam vishama prajadanam nityopacharaat yadoktanam cha hedunam mishri bhavat yada nidanam dvandvanam anyatama सर्वे वा त्रयो दोषाः युगपत् प्रकोपयत् तस्य अनुपूर्व्या ज्वरम् अभिनिवर्तयति. So that is that due to vishama prajada, due to abnormal labor and nityopachara. If in those days it was difficult to follow a proper aseptic care, so because of that there is in chances of more infection in the perineal region, leading to septicemia. As if septicemia happens, that will mostly end up in shock. So that's why it may be told that it is very difficult to cure. Nowadays we are giving antibiotics through in during labor and after we are continuing for about 5 days. So nowadays we have an intense intense preventive management in Sudiga Jwara. We will not get, but some rare cases there is chances for febrile pyrexia, but that prognosis nowadays also it is poor. Then also another nidana which is told that indulgence in uncongenial diet, if proper diet is not followed, that also will lead to jwara. Then samanya chikitsa siddhanta, the hedu matra vruddhanam doshanam yada uchayam kuryat upashamanam dhiman dadunam cha prasadanam sedo apavartanam yuktyat amapachana aushadha sevanam kashayo abhyanjanam satvir jwaragnam paramovidi. As like jwara chikitsa, first you have to reduce the utkleshita dosha, the dosha which has been aggravated should be pacified. And also in case of sudiga, unlike other jwara, there is severe dhatu kshaya will be there. It is we told that shunya sharira. So in that condition, dhatu prasadana should be, that medicine should be dhatu prasadana, and you can give swedana and yukta pajana ama pajana dravya can be done. For example, shadangan kashayam, it is ama pajana as well as dhatu prasadana. Like that medicines are told. And then always you have to keep in mind that whenever you are a medicine administering in a sudiga, up to exclusive plus milk breastfeeding lady, when you are giving a medicine, you must keep this thing in mind that it will be expressed in that medicine constituents will be expressed in the breast milk. So better not to give any kind of tikshna aushadhi like rasa aushadhi, like Vitumaran gluya we are using commonly, but for sudiga we are not using, because in that there is aconitum. So such medicine should be avoided in case of a sudiga. And also other kashaya like jwaragna kashaya, like indugandam is having panchagola. Panchagola is jwaragna and dibana, and this is told for sudiga, and it is jwarahara, nimnonadam jwaraharam. So it is told like that. And that fever is not in a regular pattern, where it is high and when the temperature goes up and down. So in that fluctuating cases, you can administer Indugandam Kashayam. Just I am mentioning some yogas which are using in clinics. Otherwise, you will get bored. That's why. So this is regarding the Sudika Jwara Samani Chikilsa. So these all the things. So I am concising. Today I dealt with first regarding Sudika Roga. So sorry, first Sudika Paricharya, Sudika Kala, then according to different acharyas, then how you are managing a patient in your clinical practice. Then regarding Samanya Roga, Samanya Rogas are not much asked for UGs. For PGs it is asked. Then Sudiga Roga Sankhya, then how Samanya Chikitsa, what all the things are Patya for Sudiga, then common medicines which are given. Next Sudiga Makkala, Sudiga Jwara. So this is regarding the topic. If you have any doubts, you are free to ask now. Hello? If anybody is having any doubt, you can ask. Thank you, Asmita. If you have any doubt in this topic, you can ask. We can have a discussion.